Hello everybody. Thought we'd explain a bit more why our service is still restricted and what we are trying to do to help. The main reason, of course, is how COVID is a respiratory disease and the mouth is a very risky place to be if you're providing treatment. If we did have a test and if they bring one into common use that can show us quickly if patients have COVID, we could be back to normal almost straight away. But because you can have COVID and no symptoms, we have to take precautions. One of the biggest concerns is when we use an aerosol. This is usual during fillings or having a treatment with the hygienist for either stain removal or gum treatment. Also, we need to drill sometimes when we're fitting crowns or bridges. The aerosol just spreads any potential virus much further than when there's no aerosol. For aerosols, the current regulations have very strict personal protective equipment involved, which is very hard to get hold of, quite restricted in its use, and we are waiting eagerly for access to this. For that reason, we are prioritising our patient base, and of course those in pain or with swellings that suggest a spreading infection are prioritised, and we look to treat them on the day of contacting us as best we can, but usually within 24 hours. And that will start with the severe case with the dentist phoning you back and talking you through what's available. If you do want to be seen on one particular day, please ring in the morning to give us a chance to get you through the process and booked in. Other priority groups include those that are safeguarding, and this can be either vulnerable children or adults. There's all different ways we can support these people, and we have good experience in safeguarding. So if you feel there's somebody who does need help and it's a potential dental problem, but there's a safeguarding element, please get in contact or ask them if you can contact us on their behalf. In the case of adults who are shielding and want to stay at home, we're very eager to find ways to give them advice over the phone or prescribe antibiotics remotely, but find a way to help them avoid coming to the practice. But if they do need to come to the practice, that can still be arranged, and by giving them the first appointment of the morning or afternoon, that's the safest option. We also moved over to a new phone system. This system can take more calls. You can hear advice while you're waiting in the queue, if there is one, and also the position in the queue. It will mean you can get through to speak to somebody much more easily. Do please only call in the first hour or so of each day if you have a severe or urgent problem. And again, ring in the morning if you hope to speak to a dentist or have a call back from a dentist the same day. We're trying our best to keep everybody up to date and in the know with what's going on. So this is mainly through emails and social media, and we're putting videos on a YouTube channel. If you're not receiving emails, please email us from that address that you want to use. That's the best way to give us your correct email address. Or ring reception and give it over the phone. And if you need to update any contact details like your mobile number or address, please ring up. There's lots of self-help videos also that we've made, and if you want to subscribe to the YouTube channel, that just means that any other videos we add to our own channel, you'll be the first to know. You'll get a reminder. It's videos from our staff. They may not be slick and very professional in like TV presenters, but we're trying our best, and I can safely say the information is very good. So as a source of information on the internet, it's a safe place to go. If you have any other topics you'd like to suggest that you'd like information on, please let us know. So from our normal days of the week where we're open, we have at least 5 dentists in, covering the service for telephone triaging and also seeing patients face to face to cover both Woodlands and Church Road practices. Our whole team cover the answering the phones, assisting the dentist with the patient visits, and also, of course, our instrument cleaning process. The management team work on a weekly basis throughout the week on trying to keep up with all the new guidance and everything that's happening. And then as a whole team, we discuss each week the best and safest way to look after our patients, depending on any new guidance and anything else we can offer. So there's a weekly team meeting and daily team meetings as well. I'm pleased to say we're one of the first practices on the world to start seeing patients face to face after lockdown, as we're eager to help. Other priority groups that maybe don't have a severe problem but are still worried about something should get in touch. It might be best to wait to ring later in the morning or the afternoon with that sort of query. We are using waiting lists to try and plan for when we can offer more treatments so that those treatments can be delivered promptly once they're available. We may want to or offer to assess you to see you're on the right waiting list. Some patients could be hoping for a filling, come in for an assessment and potentially find out that the tooth can't be fixed, in which case that tooth could be removed before they get more trouble rather than waiting a longer period before maybe fillings might come available again. Some patients will be familiar with the fact that they're normally seen every 3 months because they have more decay problems or more gum disease problems, in which case, again, please get in contact if you're concerned. We'll try to offer more support over the phone and where appropriate may ask for you to come in to be seen and assessed. All these different options depend day by day and week by week on capacity and how many of the most urgent and severe cases we're having to see. Please do get in touch if you have any concerns, any suggestions for how we could improve, and thank you for your time and watching.